Welcome everyone. Thank you for joining. We'll be starting in a few minutes, but meanwhile, please do introduce yourselves in the chat. Remember to select everyone, and please include your name, organization, and country, and a little about your work if you would like. Hi, hello. If you're just joining, thank you for being with us. We will start in just a very few minutes. Please do introduce yourselves in the chat. Meanwhile, remember to select everyone and do include your name, organization, and country, and a little about your work if you would like. It seems we have many of you online now. Thank you for being so prompt. We have English-Spanish interpretation today, and one presentation will be in Spanish. So that makes it quite important that you do select a channel. If you're comfortable in both languages, you can leave interpretation off. Otherwise, please choose English or Spanish using the interpretation icon at the bottom of your screen. It looks like a little globe. Hi, hello everyone. Thank you for joining. My name is Alexandra Yester, and I'll be your facilitator today. A little housekeeping before we get underway. So please do introduce yourself in the chat if you haven't done so already. Please remember to choose your preferred language using the interpretation icon at the bottom. It looks like a little globe. Do be aware that the webinar is being recorded, and that recording will be available to you in both English and Spanish, along with the slides and a set of resource links. And finally, please use the Q&A, and not the chat, the Q&A, to ask questions of the panelists and to upvote or comment on the questions of other attendees. Today's learning event is hosted by the Task Force on Family Strengthening, which is a working group of the Transforming Children's Care Global Collaborative Platform. For participants who are not yet members of the platform, this brings together organizations and advocates at local and global levels to collaborate to improve children's care and care systems. There's a link in the chat where you can sign up to join and receive updates about future events. The task force hosting today's webinar was formed by platform members to develop a thematic brief on family strengthening. Next slide, please. Go to the next slide. Thank you. The brief focuses on policies that can help prevent the need for children to enter into care in the first place, which of course is a critical first step in the care reform agenda. So we decided to host this learning event since social protection is so central to that effort. And in fact, it's one of the 4 policy areas that the brief will cover. Many people in the care community recognize its importance and are keen to learn more, as your participation today makes so clear. As we're all aware, poverty is a key driver of family separation, even if rarely on its own. That is, most poor children don't end up separated from their families. But even so, it raises the risks when combined with additional push or pull factors. I know this is something you're all quite familiar with. Social protection is intended to reduce the risks of impacts of poverty and the related challenges that can occur across the life cycle by providing programs and policies which support individuals and families to address those factors. Economic strengthening is a related form of programming often spearheaded by NGOs to support individuals, families, and communities in developing livelihoods which may help them escape and remain out of poverty. Given its close relationship to social protection and parallel goals, we're including this in the discussion today as well. Our panelists today will help us to better understand these programs, examining particularly how they help to support family well-being including ways they may help to prevent separation. And I'm sure you'll be thinking about those issues also as you listen to what they have to say about social protection programs. Over the next 50 minutes, we'll host a conversation between them, followed by a half hour of Q&A and discussion. If you have questions for the speakers, please do write them in the Q&A, and you can do this even early on, indicating who the question is for, and we'll address them in the second half of the discussion. So now it is my pleasure to introduce all three panelists who have been kind enough to join us for today's discussion before we start with the questions. Dominic Richardson leads social policy and economic analysis at UNICEF's Office of Research, also known as Innocenti, where he oversees work on cash transfers and cash plus programs in sub-Saharan Africa, investment in children and ECD policies, the Innocenti report card series, and research on family policies and child development and well-being. Dominic previously worked with OECD Social Policy Division on child well-being, evaluating family policies, integrating human services, and social impact investment. Dominic was awarded the 2018 Jan Trust Award, a lifetime achievement for outstanding contributions in international family studies by the National Council for Family Relations in the United States. Lisa Lauman is an independent consultant working on integrating child protection in organizational thinking and multi-sector work. From 2014 to 19, she led a project to learn about integrating household economic strengthening in programs aiming to prevent separation of children from families and to reintegrate separated children in family care. Carolina Alessino is part of the social inclusion team at UNICEF's Argentina country office. She has specialized in social protection, gender, early childhood, and care policies. In these areas, she's provided technical assistance to national and subnational governments and carried out evidence generation and public policy advocacy actions. She's published several articles and co-authored the book, The Future is Today, Early Childhood in Argentina. And now we will move to our first question and over to Dominic. Dominic, you've been involved in extensive research around family policies, including social protection, both for UNICEF and OECD. Can you give our participants a sense of the kinds of programs you found to have a wide impact on family well-being? Most participants here are familiar with cash and cash plus programming, so of course it's good to refer to those, but perhaps also mention social protection policies that might be less familiar to them. And do feel free to elaborate on my quick social protection definitions first, if you feel that might help. Over to you.
Wonderful, thanks, Alex. And it's a great pleasure to talk to everybody. Such an important conversation. To quickly elaborate on social protection, well, you might be surprised to find that there isn't a common definition for social protection globally or its purpose. UNICEF says that social protection is there to address poverty and social exclusion. UNRISD says it's in the promotion of well-being. I think it's certainly in both. In amongst that, you could go in deeper and talk about avoiding improving family functioning, avoiding separation of families, and so on and so forth. In terms of the types of policies we see in social protection, what you're looking at here is a schema for child, family, and policies overall. And in different countries, some of these policies might fall in or outside of social protection remit. For me, social protection here is the cash benefits and the social and human services specifically. We might also want to include tax breaks for family raising children. You'll see active labor market policies in there. But outside of the family and child portfolio, you'll also see things like unemployment benefits, accommodation allowances, minimum income guarantees, and certainly pensions. These are all important for promoting and strengthening the situation of families to address poverty and social exclusion, and end up being invested in the family as a whole, improving the context around children and parents raising children, and therefore can be essential to promoting child and family well-being. In amongst social protection, you can deliver it in different ways. Primarily, it's through social assistance or social insurance. Social assistance mainly being tax funded, and social insurance mainly being individual contributions. You might pay into social insurance to ensure you get a pension later down the line, but social insurance can appear in maternity benefits, parental leave benefits, and even in family allowances. Social assistance can appear in all of the same types of benefits, but you're not necessarily required to pay into an individual contribution, you know, so through deductions in your wage packet. It's important to distinguish between the two because to get into social insurance, it's mainly through formal labour market, access to the formal labour market. It may be also subject to eligibility criteria that you'll see in social assistance also, which is whether you've lived in the country long enough, residency criteria, or categorical eligibility, like you're a sole parent, or you have one child or 4 children, or the ages of children, and so on and so forth. Those types of criteria can exist across the board. Let's click on, it's interesting to look at family policy. So if we can move to the next slide. Generally, I think family policies are there to provide not just information, but resources, and in some cases like time for families, but to really make them work well. Families also need a rationale for engaging with family policies. Why should they send their children to childcare? And of course, the agency to do so. So there's some more thinking. It's not just about the existence of the policy, but the implementation of the policy that makes it effective. We did do a study on family policies in the SDGs, and that's going to be available to you through a link. And we looked at the types of social protection policies that are available to families and what they could contribute to the SDGs. You might see the SDGs is a complex set of targets, 160 odd targets under 17 goals. There's only about 11 or 12 policy remits to deal with those things. Families are not mentioned in the SDGs, but family policies are very important. We know that the cash benefits consistently reduce poverty and deprivation of all kinds. That means universal benefits and unconditional and conditional cash transfers. They're important for promoting employment, formalization, and essential to gender equality. And actually right now, there's nowhere in the world that has a fully gender equitable social protection system. Always favors men, mainly through parental leave policies. Family-focused health approaches are also important. That means not necessarily through the doctor, primary secondary healthcare, but policies which are delivered through human services direct to the family. You may be surprised to find that if you deliver a human service to the whole family at once, the family behavior changes quicker and more effectively than if it goes to individual people. That might be to do with suicide ideation or even behavior, consumption patterns and so on. Parental factors are key to education success. If policies for families strengthen the conditions of the family functioning or the parental employment, that feeds through to children's outcomes, mainly for school access, less so for learning. We talked about gender neutrality, it's important there, but importantly for family separation and the conditions of family functioning, family policies and particularly interventions at the family level through human services and social services are shown to reduce violence and improve people's understandings in regards to behaviors that are more socially acceptable. And nurse-family partnerships are very important. Let's move to the next slide. I wanted to say a little bit about, let's pass that one. I don't think I have time for it, but that just says that family policies have multiple spillovers, lower poverty, better outcomes down the line. The other thing I wanted to tell you about was about age and the importance of timing for family policies and particularly social protection policies. If a family has a child under 6, they're most likely to be accessing social protection overall, not education, for instance, not quite there yet, the child's not old enough. Well, our recent work has shown that age-related development of basic human skills is all going on from in utero onwards. If you click to the next picture, we looked at listening, empathizing, and inquiring. All of these things are malleable, measurable, observable in children under the age of 2. Pre-vocal, before they're speaking, children ask questions with their hands, their eyes, with what they play with, and so on. As before they even get to school, They're discerning patterns, observing, reflecting, relaxing, sensing, all things that get us going in life. I want you to remember this because social protection makes up the biggest intervention in the preschool years. And I'm going to show you what countries are doing in a minute, and you might be surprised to see what's happening. Let's click on again to the last thing. As we go into adolescence and later in life, there's fluency in these development of the skills, but we really lay down the foundations in the preschool years before a single education dollar is spent. Can we click on to the next slide? I want to quickly tell over to the next one, please. I want to quickly tell you a bit about a study that we'll be publishing next month. We've been looking at 84 countries and how they spend their money by age from prenatal to 23. If we assume that money can be spent equally across the ages that we value, the timing of spending equally in younger and older children, then we might see a spending that looks like this. If you click again, if we see spending, or if we assume that children that are younger should receive more investment, like Heckman might tell us, we'd see a picture like this with a higher spending earlier and lower later. If we go into adolescence, we might see a picture like this. So it increases as we get to 13, 15, when children are about to leave school. I'm going to show you what countries are actually doing and then split it up by different types of spending. Here's an example of how Switzerland spends its money on families with children. Cash benefits, form of social protection. Childcare, form of social protection. A very thin line on in-kind public works, accommodation, child protection service, almost invisible in Switzerland at the central government level. It's very thin. And then the big block, the main block, is education. If you're looking for a Heckman-style profile and good investment in the early years, then Switzerland's not going to be your model right now. More money going on education. If we click again, so the money's coming in too late. There's few countries that actually get it in early. When we go to middle-income countries, in case of Brazil, you can see even before children get to school, there's very, very little in comparison. More in childcare than education, and the scale's gone from around about 14,000 to 6,000, the y-axis. Again, education is the most dominant form of investment, and social protection is low. If we go on to the next slide, we'll look at Ethiopia next. Ethiopia is indicative of a lot of countries in West Africa and East and Southern Africa. We're looking at the $6,000 scale. There's barely any money. It's almost 95% more education, all of it in tertiary, nothing really in social protection. Let's click on. I'll get through it, thank you. So this is what high-income countries, OECD countries spend overall. It might be surprising to find that an average G7 country spends 40% of every dollar on social protection. That's more than health and education combined. When we go to low-income countries, social protection is often invisible. It's really not there. Education dominates in the early years, and we all know that not all children are getting into education. This drives inequality both within and between countries. In a high-income country, 26% of a dollar spent on a child goes on the under sixes. In a middle-income country, it's nearer 10%. In a low-income country, if we keep moving, it's only 6%. Social protection is a missing key element in what we're doing for children globally, and severely inhibits the raising of children in the early years and family functioning in the early years. And essentially, I don't understand why, as a community, we're not shouting a bit louder about the contradiction between how high-income countries manage their budgets for families and children, care-heavy, cash-heavy, in comparison to low and middle-income countries, as if those countries are going to learn their way out of poverty. But in high-income countries, we're going to get a bit more of a helping hand. We click to the last slide. I just want to show you all these things together. This will give you a picture on the same scale, average spending of 14,000, average child in a high-income country, bottom right. Just take a moment to have a look at this. The invisibility of social protection, despite what we know about child development, despite what we know about its importance for the sustainable development goals, remains almost invisible in the work done in countries that are not in the OECD. This is a stymies social development, stymies human development, and essentially, I think we'll all retire before we see any decent changes in care and family strengthening as long as this situation continues. Sorry for the bad news, and I hope I've not run over. Thank you so much, Alex, and thank you for listening.
Dominic, thank you so much for that brave and successful effort to transmit so much information in a short amount of time. Would another panelist like to comment on Dominic's remarks?
Well, yeah, maybe Alex can.
Lena, please come in.
Yeah, so thank you, Dominic. It was great presentation, and as I was listening, there were like maybe three ideas that stick with me. One has to do with no silver bullets, no, and how we need to push for integrated approaches that take into consideration all the dimensions that affect family well-being, and also the importance of timing, not to invest too late, and how investing in children, it's a right in itself that children have to have proper investment to access and exercise their rights, but it also makes economic sense. So I think that's another message, and maybe on this final topic that Dominic was mentioning, and the bad news that are actually also a call to action, not to shout louder. I think it brings another topic into the discussion regarding budgets and how can we push for budgets that are focused on social protection, but are also focused on child-sensitive social protection. And what actions can we take as advocates to push for budgets that take into consideration children and social protection more broadly, and not to have so little so late. So I think that those ideas stick with me as I listen.
Carolina, thank you so much. I think that's helped put Dominic's work even in further perspective, and to really highlight the key points. Now let me turn to Lisa. Lisa, you have done extensive work on economic strengthening, and you're also quite familiar with the literature on cash transfers and their impact on preventing separation. So you're a little more in the middle of these two communities. And you're particularly familiar in low-income settings. Can you tell us about some of your research and findings in this area? I know our listeners, our participants would like to know what types of programs seem to have the most impact on preventing separation in different settings, including any critical lessons you might have from the Aspire project that you've been so involved with that you'd like to share.
Sure, thank you, and hello everyone. It's a pleasure to be here and nice to see some familiar names on the chat. So shifting from Dominic's broad focus on social protection, that lens, I'd like to narrow the focus to household economic strengthening, which we call HES, and family preservation. And I'd like to share a little bit about work I was involved in as part of the USAID funded Aspires project, as Alex noted. And just to start, I'd like to remind us that poverty is understood by practitioners as one important driver of family-child separation. And the Aspires Family Care Project was intended to develop evidence and guidance related to how HES might help prevent separation of children from their families and support reintegration of already separated children in family care in combination with other forms of support. So I realize this is probably not new information for most of you, but just to orient the discussion to household economic strengthening, practitioners see HES as a process that involves developing and increasing assets that improve people's living conditions. And there are many different interventions that practitioners might choose to support this process. And people sometimes think of HES in different ways, but I think that kind of general description is fairly commonly shared among practitioners. Practitioners use HES as a component of many types of programs that address particular concerns where poverty is an issue, like extreme poverty and women's economic inclusion, or child malnutrition and child development and well-being. So we can think of these programs as being generally located at the targeted prevention and response levels of an intervention pyramid. So HES is not being applied to entire broad national populations or huge subsets of those populations, but it tends to be more focused geographically and with a more narrowly defined population. HES programming is often time limited and focused on how families get money and how they spend it. It may help stabilize households and help them be more resilient to shocks, but it's not the silver bullet to end poverty itself. And many feel that household economic strengthening intervention should be tailored to the individual household. So based on their capacities and abilities and needs. And one size does not necessarily fit all. Sometimes HES interventions or programs that include HES try to provide on a limited scale some of the services and supports that might otherwise be provided by social protection. The evidence base on how HES preventions help to support and protect highly vulnerable children is growing, but still limited. And in relation to family-child separation, it's even more limited. You could just shift to the next slide, please. So returning to our experience with Aspire's Family Care, we did an extensive literature review and consulted practitioners, some of you may be here today, and others, to try to learn what drives family-child separation and how HES interventions might address those drivers. We learned that drivers of separation are diverse, that families often experience multiple drivers before a separation, and that poverty often plays an important role, but not a sole role. So we looked at that literature and did those consultations, and then a talented colleague developed this concept map of common factors contributing to families' separation based on the literature review and consultations. And what you see on this slide in the colored boxes are types of family resources shown in green and household conditions shown in the darker blue that are often reported as not present when children are placed in residential care, and that researchers and others think contribute to family-child separation. Elements of family context in the lighter blue can influence these resources and conditions. And our idea was that addressing these drivers might help prevent families from separating or from re-separating when a previously separated child returns to a family. We then mapped, for illustrative purposes, common HES and other family strengthening interventions onto the elements in this map that they might address, drawing on the literature review. So, for example, financial literacy might connect to human resources, financial resources, physical assets, and family context. And limited cash transfers of the sort that we use in time-limited projects might connect to family financial resources and physical assets, and to the household conditions, shelter, and food security. That's just an example, but that's how we sort of hypothesized that this worked. To investigate the idea of tackling drivers of separation, Aspire's Family Care funded 2 learning projects in Uganda, both aimed at preventing separation in high-risk families and reintegrating separated children. Both projects provided case management to enrolled families and offered both HES and social strengthening interventions to them. Both provided time-limited cash transfers to the poorest families, and cash transfers were reinforced with some form of financial literacy and business or enterprise skills training, along with some coaching. Both also had savings groups interventions, and there were other interventions as well. So we had 2 differently designed projects in the same country that addressed common criteria, and they both had a lot going on. To the best of our understanding, no participants received formal social protection support, and some, though not all, had been previously involved in other projects. Broadly, our research on these projects found, baseline to endline, that there was reduced separation, reduced economic vulnerability, and improved child and caregiver well-being indicators. This was more the case for prevention families than for the families that were reintegrating children. Our qualitative research suggested that cash transfers, savings groups, and one project's match savings intervention had direct effects on payment of school fees, purchase of scholastic materials, food, and medical care for children. Our qualitative research also suggested that financial literacy and business skills development helped improve caregiver budget skills and caregiver motivation to prioritize education, and increased household income through business with positive indirect effects on children. We could just switch to the next slide, please. We also learned about some social benefits to economic well-being, as you can see in this slide, as well as economic benefits to social well-being. So for this caregiver, her cash transfer helped her pay the rent on time. So her landlady didn't harass her and her neighbors didn't gossip about her. So she was able to sleep better. She was able to buy food, including milk and sugar for the children, and invest in her business. Her children experienced less money-related stress, which improved their relationship. The caregiver was less stressed, so she didn't yell at her children, and she was able to apply communication strategies she learned in parenting skills training. So I think I'll stop here. I think I'm probably at about time, but more to share in the Q&A session.
Thank you so much, Lisa, and you've gotten us to a much more specific look at some programming that's certainly social protection adjacent and very important to people who are listening in today. I'm now, I'd like to see if someone would like to respond or to comment on Lisa's presentation. Dominic, I think you might have had some feedback.
Yes, yeah, thank you. Thank you, Lisa. Really excellent presentation. What resonates with me most of all is how sort of improved finances and improved sort of economic conditions for the family feed through to so many things which are integral to well-being. The reduction of caregivers' stress, food security, the child's stress, and so on. This is really important. And also dealing with what we would call one of the major myths in relation to supports, financial supports for families, that the money is not going to go on productivity or investment in family functioning. You know, I'm bringing a personal note here. My father used to tell me, he said, when poverty comes through the door, love goes out of the window. And if you're in a situation where you can't manage your family functioning for stresses and your mind is full of the concerns of, you know, hand to mouth, day to day, it's not easy to concentrate on the things you want to do in life, which is spend quality time with your family, fulfill your dreams, whether they be economic or social or other. And it's no surprise that the situation of the family would deteriorate, and so it's no surprise that the counter is observed. Just to say, we found very similar effects in our work recently with Angola, in Angola, and the application of Valor Criança. Very, very similar in the qualitative process evaluation of things we're seeing on screen right now. And I think actually this type of methodology, what you've applied here, Lisa, is really exceptionally valuable to our efforts to further promote these types of interventions globally. So thank you so much, Liz.
Thanks, everyone.
So great to have two very evidence-focused panelists. In fact, all three. But listening to you two, we really show, and it's great to see that those areas of agreement between you. I'm now happy to turn to Carolina, and I'd like to let everyone know that Carolina will be presenting in Spanish. So if you have not chosen the English channel, if you would prefer to listen in English, please do so now. Carolina, Argentina has a quite comprehensive universal child grant, and UNICEF has been involved in helping to shape and strengthen this over the years. Could you describe the program and some of the impacts you've seen, especially on vulnerable children?
Muchas gracias, Alex.
Thank you very much, Alex. Yes, I was invited to give this presentation in my mother tongue, language, so that's important. Argentina advanced very much in the last decades to be able to work in their social services, specifically in the income protection for children and adolescents. Now we have a system that gives coverage around 94% of children. It's very large. And to do is to have this contributive system that covers many families, tax deductions that covers around 27% of families with children, and non-contributory system that has to do mainly with transfers that are conditioned, and that covers 37% of children. There are still 5% of children without coverage. And the result is a system that, even though it is large, but is fragmented. Next slide, please. I wanted to share also what is the main program of this conditional cash transfer in Argentina, which is Universal Child Allowance. This is what we call a pillar of non-contribution for the social protection in Argentina, and it began 2009. It is for pregnant women with families with children under the age of 18, or any age if there is a case of disability. Their parents are unemployed or they work in the informal sector for a salary under the minimum wage, or are domestic workers. It has the normal conditionalities in health, vaccination, checkups, school attendance, and it represents around about $50 a month, and 20% is accumulated and pays once a year after the certification of the conditionalities. It represents 0.5% of the GDP. There are some assessments that, even though this is not the focus of what I wanted to share, in health, there are not significant results, but in education, we do see that we need to increase school attendance to grammar school and a major attendance. It's not enough to attract girls and women that are outside the attention of school. We have been able to have this as a state policy, and even it goes through the changes of government. It's not a social plan, but rather it is a pillar of the protection services. In terms of income and well-being and poverty, next slide, please. I have some that Argentina is now in a very complex situation. Our rate of inflation is very high. In this context, the majority of children are in poverty. 13% are extremely poor, and the prices increase much faster than salaries. These numbers will even grow. Here, the role of the policies of social protection has been very significant, especially what has to do with that extreme poverty. Without this, the poverty in children would be 4% more, and the extreme poverty would be higher too. Besides, and thinking on a situation that is in Argentina, but as I have heard in Latin America is a characteristic, it has to do with the structure of employment. In a situation of informal employment, we have 40% in Argentina of informal employment, and this is a feature of working. So the policies on income, it does not give a certainty for all those informal workers that do not have access to social protection. The last slide, please. Here are some challenges that we still face in Argentina, and that it has an effect on the well-being of children. One has to do with the coverage. As I mentioned, there are still 700 million children without any protection, but also the difficulties of these systems that are combined with the contributive and not contributive. There are gaps in access. In 2022, 300 children were excluded from the non-contributory subsystem. The migration between one system to another system are not automatic, and also there are certain conditions in this non-contributory subsystem, and this for children, it depends on what the employment of their parents are. On one hand, some children are out of the system because of the difficulties of certification. For example, 300,000 children were excluded in 2022 because of difficulties in certification, and also overload of work on women who are usually in charge of the certification. And in a context like we live in our country where inflation is very high, there is a percentage of 20% that is paid in the year. This generates in the capacity of purchase of if there's transfer. And this has to do with sufficiency. Currently, the main transfers cover approximately 45% of the food basket. In other words, that's extreme poverty, and 20% to the total of the poverty basket. So in this, these values go down in the non-contributory. It is important also to think how can we generate mechanisms of updating and those policies of transfer be enough so that families at least not live in extreme poverty and to allow to have better well-being in families, as Lisa and Dominic were mentioning, how to contribute to have families with less stress so that they can have food on their tables every day. A recommendation that comes out in our work has to do with universal situations for all children for social protection and to have a positive well-being in children and their families. So thank you, and back to you, Alex.
Thank you so much, Carolina. Argentina's example is such a fascinating one, and even as an upper middle income country, as you say, with the levels of inequality, there is some real extreme poverty in Argentina. It impresses me to see how much effort is made to continue to improve the program. And now let me invite comments from another panelist.
Sure, this is Lisa. I'll jump in if I can. So Carolina, thank you so much for a really, really interesting, comprehensive and thought-provoking presentation. I just, one of the things that struck me as I was watching your slides and listening to you speak was so impressed by the large proportion of children that are covered by the system as a whole in Argentina, and equally struck by the gigantic number of children who are not reached. So, on the one hand, I felt great joy. On the other hand, great sorrow to realize that so many children are excluded from the system. I was struck by what you said about the burden placed on women and the labor and effort that is required just to stay compliant and within a system. I think that's something that really we need to think about and look into carefully. That's one of many access issues that people face in terms of social protection, I think. And I think there's a role for both quantitative and qualitative research to really kind of understand what those barriers are and what we can do to try to reduce them. I also just wanted to reiterate what you said about the transfer amounts. It seems that this comes out in the literature across the board, that cash transfers are helpful, but in so many cases, they are just insufficient to meet the needs. And they may help people from sliding radically backward into poverty, but they don't even necessarily help you keep up with yourself and, with the living standard, and especially in times of inflation. So just something there about thinking about how to, how can things be supported so that children and families actually have enough to support their healthy development and well-being. Yeah, and just and another point with respect to that sufficiency is just that, we see that when people have enough, they're not only able to survive, they're able to take advantage of opportunities that are out there, whether those are economic strengthening opportunities, educational opportunities, that comfort and ability that comes with not still having to fight for the food on the table, I think, opens up new vistas for people, and that's very important. And then just wanted to circle back on that question of conditionalities. It seems to me that that while there's evidence that conditionalities are helpful, there's also evidence that they are not. And it'll be interesting to see as time goes on and we continually refresh our knowledge and understanding, how useful those appear to be, especially for families who are who are facing very specific kinds of challenges. I'll stop there.
Thank you so much, Lisa and Carolina. We're now, I love how each of the panelists commenting on one another's has really brought out the key points, and you can see several themes emerging here, and perhaps people will like to dive more deeply into some of them in the Q&A. But for now, I'd like to turn to some questions that I think will be of interest to our participants, and any of our panelists can answer. We'll just spend about a little under 15 minutes on this, so we leave enough time for the Q&A. The first question is on disability. We can go to the next slide. It is clear that families of children with disability face extra challenges and costs, and that the risk of placement in alternative care is much higher. Families where caregivers have a disability also face an additional strain. What role can social protection play to support these families and to mitigate these risks? Can any of the panelists suggest any successful examples that might come to mind?
I can jump in. I'm in no way an expert on the topic, but it's a topic of interest to me, so I've tried to educate myself. And this kind of follows on the previous discussion. I just thought I would note that disability, just having a disability in the household adds costs to that household. And so I was looking at some data, and in Bosnia and Herzegovina, there's an estimate that it adds about 14% to the family's economic cost if there's a member with a disability. And in Cambodia, that figure is about 19%. And so disability and poverty are really closely related, and it's important to think about how the social protection systems can try to address these needs. Some of the barriers that people with disabilities face, including children with disability, are access to education, and as they go through their life cycle, access to employment opportunities. And those are also connected to poverty. So those are things that we need to think about. And so the kinds of things that social protection systems need to think about are, for children, child disability benefits that are in addition to whatever social benefits are available in terms of basic income support. Benefits that for carers that can help care, that enable them to care for their children. For adults, disability related in-kind benefits that may help cover additional costs that they face, as well as things that help them replace their income, that they may not be able to earn a full income. There are also issues that need to be addressed, such as, just the physical challenge of getting benefits. Do you need to go to an office to pick them up? Are there other ways to get them? And so, for example, in Nepal, people with disabilities have the ability to have a proxy pick up their benefits, or to have a government person deliver their benefits at home. Now, how extensive that is, I'm not sure, but that is a kind of example of a disability-friendly benefit. There are also challenges related to information access. So thinking about how people, or household families that are facing those challenges, how they get information about what's available to them. And also making sure that they're not facing additional costs to access their benefits. So are there costs for paperwork or costs that are incurred when you're going to and from, the complicated offices and a bureaucracy? And then I thought I'd just give a couple of examples that I found of benefits. So for example, in Serbia and Moldova, they provide transportation subsidies for children to get to school. In North Macedonia, there's a contributory scheme to help replace salary of caregivers when they're caring for a disabled child. In Belarus, there's a facility to provide respite care for carers. And then in Kazakhstan, there's a facility to provide some home-based social support for families that have a member with a disability. And then also one other thing, and I think Dominic, you mentioned this, is it's important to think about what the labor market policies are as well. So is there a legal framework that supports access to work for people with disabilities, accommodations at work, and those kinds of needs? So let me stop there. Those are just some examples that I learned about and I wanted to share with you all.
Great, Lisa. Thank you. Really comprehensive and helpful. I think Carolina, you wanted to add on something as well?
Yes, just two brief thoughts. First, related to what Lisa mentioned, that family with children with disabilities do need further support from the social protection system. In Argentina, we also have some policies to address this, like the right to health treatments, higher family allowances and without an age limit, longer maternity, paternity leaves, and free public transport, among others. But to be able to access these rights, they need to have a disability certificate. And this is where all these things that Lisa mentioned come up. There is a great proportion of children who do not have access to it because of barriers related to lack of information, distance from where they live to the health facilities or the evaluation centers, the fact that they had to renew the certification even when the disability they have cannot be changed and they do not need to certify it again, but they are asked to anyway, a very long waiting list, among others. So we think it's important to make families, communities, and public workers aware of the importance and how to include people with disabilities. And it's also crucial to make it easier to access the certification of disabilities, especially for vulnerable populations that live away from main capital cities or main health centers. But also, I think there is another point that is regarding families where caregivers have disabilities, and how we also need specific programs to design and implement to support people with disabilities to be able to care for their children, to gain autonomy, and how we can improve that. I think Mark mentioned something in the Q&A. There was a question also regarding this. And we know here in Argentina, we have some specific programs, and there are some successful cases where parents with disabilities access this type of programs to support the task related to care for her children. But these programs are not very extended or well known among the population. They don't have the reach that they should. But I think that that's another point to avoid separation, because many times when the caregiver has a disability, there are extra difficulties and could lead to family separation, when this could be overcome if they have further support to exercise the right to care.
Thank you. Thank you so much, Carolina and Lisa. Really comprehensive on this, and I know a topic of great interest to many people in the care community. Let's turn now to the next question on migration. Next slide, please. Economics, conflict, and persecution all fuel migration, both internal and international. Children may be left behind in the care of grandparents or others. They may migrate with their parents and end up in precarious circumstances with reduced access to services. And all of these circumstances can raise the risk of separation from caregivers. It's a lot, but are there some social protection solutions which can help mitigate these risks?
Alex, I think I can jump in here. Well, there certainly are, and I suppose we've seen some of them with the response to the Ukraine conflict, allowing refugees, for instance, to quickly access existing social protection systems in host countries. That's under a position of conflict, but it gets more complicated. I mean, we're talking about when parents migrate for economic reasons and the split generation families and the reliance on remittances. In those cases, it's not disassociated to issues of disability, but understanding that when elderly people are caring for children and parents have migrated, a consideration of the additional costs in the families, integrated into the benefits, the pensions or the minimum income guarantees would be useful. I don't know of a single basket of good model for assessing minimum income, basic income, or minimum wage that accounts for disability, the additional costs of disability. And there's certainly not a poverty measure out there, whether it be relative or absolute in income terms, which accounts for that, nor the additional demands on migrants. There's other methods by which international agreements and passporting of benefit rights exist, and where you can pick up your child benefits if you live in a different country. This happens a lot within European countries, but also can happen elsewhere. And then there's other considerations, and particularly in terms of the categorical eligibility concerns. You can go to the most advanced welfare states in the world, and you'll see behind the most generous social assistance benefits that residency criteria exist. So if you're a new mother in Denmark and you're just having a baby, but you arrived in the last 2 years, no maternity benefit for you. So there's things hidden in these details which we could do away with, because frankly, the evidence suggests that migrants are a net economic gain in most countries, and to exclude them from social protection on the basis that they're not contributing enough or they're not taxpayers, particularly when we talk about economic migration, is just fallacy. And so social protection could respond to that better. I think there's also concerns around conditionalities. When there's a number of conditionalities placed on a parent to access a benefit, if you're a migrant, particularly in a country where it's not your mother tongue, there may be difficulties there which are resulting in you being excluded from benefits simply because of the design of the program itself. I mean, essentially, for me, it kind of boils down to one thing. I mean, Adam Smith would say, make it easy to pay your taxes and make it difficult to receive your benefits. Actually, if we assume that access to social protection is a public good, we should flip at least the second half of that. Make it easy to pay your taxes and make it easy to receive your benefits. If not, they'll always be suboptimal. Migrants and for others too. Thanks.
Thank you, Dominic. I really love how you actually got into an even wider frame there about the importance of social protection, putting migration within that. And it really underscores the kinds of takeaways that I hope our participants will glean from today's discussion. Let me turn now to the final question on gender, which each of you has mentioned in your presentations. As already noted, both poverty risks and domestic and care burdens nearly always highest for women. From your research or experience, are there social protection or economic strengthening policies and programs that have been particularly effective in promoting gender equality while also supporting family care for children? Would be great to learn. So any panelists, please speak up. Carolina was going to come in on.
I can come in on this. I think that maybe just a quick thought, but I believe that a key social protection pillar that needs to be strengthened is the one referred to integrated care systems. This is a discussion that is currently undergoing in many countries in Latin America, including Argentina, but we still have a long way to go. I mean, integrated care system seeks to ensure that all families have the time, services, and money needed to care for the family members. And in the case of children, this refers to, among others, maternity, paternity leaves, public quality childcare services, cash transfers. And care systems are key to ensure that all children have access to proper care, but also to ensure that women, who are the ones who deal the most, can continue their education, can access the job market and get formal jobs or work more hours if they want to. So it also has an impact on child poverty and family well-being. So I think that we have to generate dialogues between child poverty reduction policies and care policies. I think it's a key point to address, because we know that the care burden is higher among women. We know that in many households, women are the only ones in charge of children, that there are a lot of households with only women, and poverty levels are way higher on those households, at least here in Argentina. So we need to, I think that's a discussion that needs to be addressed. Thank you.
Thanks, Carolina. Anyone else? Dominic?
Yeah, thank you. I just want to perhaps highlight something I raised earlier. It's about the importance of particularly around parental leave and the care policies at birth. At the present, there's no country in the world that treats mothers and fathers the same in terms of parental leave eligibility. It doesn't mean that we're asking for mothers to have less, but in front of an employer, a mother and a father of equal capability in the labour market are viewed differently because of the rights of the mother in terms of overall leave, and that has effects on the mother's long-term career trajectory, attachment to the labour market and earnings. That's shown in several studies which you can find cited in the report on family policies and the SDGs, which I raised. Now, when we know that the majority of sole parent families are also headed by mothers, I think it's still around about 90% of total. This detachment from the labour market, which is brought on not by an example of good or sort of social protection doing anything other than just doing what it's done traditionally, brings in the poverty risks, accentuates longer term poverty risks, and therefore all of the things that follow, family stresses and the potential for family breakdown. We know that cash transfers can empower women. We know that well-managed and well-designed social protection policies can address not only gender inequalities, but encourage longer-term changes to social norms around gender, which are the types of things we also need to be aiming at, rather than just treating the inequalities we see. And I encourage people to have a look at our GRASP project, which is our gender responsive age-sensitive social protection study, which you can find, plugging it now on the Innocenti website. Thanks.
Thanks. Thank you, Dominic. And maybe this is a good moment to remind people that there will be a list of resources made available. I know it was quite a lot of information that you received from our panelists, and they have kindly provided links to key resources that you'll receive after, so you'll be able to continue the learning after the meeting. I'm really grateful to all of you for those responses. We have a few questions in the Q&A, so we'll now start turning to those. So first, Lisa, there are quite a few for you. So I think I'll start with you. You've been more quiet recently. So some of these questions, I think others will also want to comment on, which is, and that will be welcome, but we'll start with Lisa. Someone has asked, if ending or reducing poverty is a priority, how sustainable is the cash transfer intervention? So I think they're talking specifically about the economic strengthening work. And are there other approaches to supporting families to end poverty? Related to that, how long do the household economic strengthening programs implement cash transfer aspects on average? Over to you, Lisa.
Great, thank you. So to start with the second question first, I will say that programs that are trying to reintegrate children in family care or prevent family-child separation, if they're providing a cash transfer component of the project, it's quite variable. So some organizations will provide a cash transfer for as short a period of time as 3 months if they feel that the family is fairly stable and that's warranted. And I think examples of that maybe came from Central Europe. Others continue for a longer period of time. Some recommended that these kinds of cash transfers be available to families for a period of 1 to 2 years. In our projects, both of our projects, they implemented their cash transfers slightly differently, but they were cash delivered over a period of, mostly a 6-month period. And then we continued the other programming for at least another 6 months with them, so we could try to see the effects of that. And I will say that it was from our implementing colleagues, and also from some of our feedback from the program participants, the cash transfers were not of sufficient duration and they were not of sufficient amount. And so I think that's really something that is important for us to remember. In terms of how sustainable it is, for a relatively short-term project, a 2-year, 5-year project, I think cash transfers can have a benefit. It's not something that's easily sustainably implementable by an NGO, I would say. They cost a lot of money. Once you set up a system, they can be relatively easy to deliver, which is great. But they cannot replace social protection. And so, while social protection is not the silver bullet out of poverty, 100%, neither is household economic strengthening. But I think these two types of programs can scaffold on each other and help, and through them help families develop skills and capacities and abilities that make them more likely to be able to develop a livelihood and to do more for themselves economically as time goes on. So I don't have the whole answer to the problem, but I think both elements are parts of the solution.
Thanks, Lisa. I think on duration and sustainability of cash transfers, I have a feeling that both Catalina and possibly Dom will have something to say. Over to you, Catalina.
Yeah, can you hear me there? I lost the sound for a little while. But yeah, I also wanted to jump in if that's okay with the related topic to this that was on the Q&A regarding budget allocation and how can we ensure sustainability on budgets addressed to children, and how can we advocate as practitioners and civil society and international organizations on this. And I think that was a question raised by Veronica. So I wanted to share some thoughts with you on this. In Argentina, we have been doing some work around budget allocation on children and on social protection. And I think that a key lesson that we learned throughout the year is that it's very important, first of all, to identify how much we spend currently on children. So we have been doing a lot of work on how to label the budget that is addressed to children, how to identify which resources are led to social protection. And we now have, we have been working with the Ministry of Finance on this, and we have now a specific chapter on the budget law that is sent every year to Congress that identifies which are the resources allocated to children. So I think that that's one first starting point that we need to know, or that it was useful to us to know what are we talking about when we talk about budget addressed to children. And then how to monitor that budget throughout the years to ensure that there are not cutbacks in that resources, in our case, in real terms because of the high inflation. But I think that on this and on advocacy, for us, it was key. First, how we translate those findings into very concrete messages that everybody can understand. And how, because when you talk with the Ministry of Finance is one thing, but then you turn to the sectors, to health, to education, to child protection, and sometimes they don't even know how much resources they have allocated or how those budgets were built. So to work also with the sector so they can advocate for budgets for their lines, I think it's also important. And also to work with the legislative branch that sometimes it's another key actor, the Congress and in our case, the Senator's House, where these laws around budget are discussed, and that they act like also a public forum, because when they are discussing the budget, there is a lot of media and public discussion going on. So I think that to also work with legislators, it's key to advocate for further spending on social protection and children.
Great, thanks, Carolina. And I think Dominic wants to come in on from a different perspective on the same question. Dom.
Yeah, and thanks. I want to talk briefly about the regularity and adequacy of benefits amounts. We talked a little bit about, you know, the calculation of those amounts, often in relation to, you know, minimum wages or basket of goods or other. But the decision certainly in relation to the amounts paid will affect what the family can do with it. Now, evidence from, so bring it again, the evidence from Angola looked at recently, there was an affected change in the amount of the benefit paid because of difficulties in getting to the villages where the payments should be made during COVID. And basically the money was stacked up over time. And initially the family respondents were saying that the amount of money was insufficient to meet their basic needs. But when the benefits were sort of collated because it was difficult to deliver, a large payment was made, a one-off payment, which resulted in those families investing much more in economic productivity. So they were purchasing things, developing cooperatives, and you know, sort of farming equipment starting to be purchased, something that you couldn't do with one-off payments. Now, it doesn't mean that one or the other is the solution, because nobody wants a cash benefit system that essentially sponsors poverty, where you live hand to mouth and you fundamentally don't change the underlying determinants of poverty. At the same time, you don't want to say, well, here's a big lump sum, away you go, make it work. Because it might not work for some, and it might affect the status of the markets around it, change grain prices, local, whatever else. That people need to be on top of this all the time, and then there's sort of the consideration of the infrastructure that's required to deliver on those benefits. For my mind, across the life course, there should always be benefits in place that meet the minimum living standards and the rights of the children and the rights of the families, to ensure these things. And in cases where the community or the family could benefit from sort of a household economic benefits can be made. And you see them in high-income countries, and you see these efforts elsewhere too. It's part of a more complex portfolio of social protection, which we should be thinking about if we can get the budgets behind it, and if we can replicate what most bilateral donors do in their own countries, for goodness sakes, but will not talk about it seriously when they go abroad. So there's quite a lot to think about. There's quite a lot to think about here, but essentially, we need to ensure that the money's in place to provide benefit and regular benefits that are adequate so families can plan, but at the same time be prepared to pay something in. Or just one more reflection. It goes back to gender. When we paid the big payments to the families in Angola, we paid them to the primary carer, not the father or the mother, but the person that cared for the children most often. That was most often the mother, but not always. And when we did the mega cycle, which is the one big payment for the year, some women were walking 20 kilometers to collect that money. So we're talking about the transaction costs of receiving these things. There were also examples of women experiencing aggression and harassment when carrying that type of money around. So when we think adequacy and regularity, we have to think system and safety, transaction costs. And it would help if we just started thinking social protection is a necessity for development, and get the money behind it, as Carolina's been talking.
Thanks, Dominic. And let me just add to that: social protection is a right. It's in the Human Rights Charter, and I think that we forget this. And it's something for all of us to keep in mind. I want to come now. There was another question for Lisa, but I think is relevant to all of you. I'm going to play with it a bit. There were two questions around mentoring. What role does the panel see for community mentoring in household and economic strengthening, e.g. involving local business leaders, church leaders, savings clubs, chiefs, etc.? And someone noted that mentoring seemed to be a key factor in what you were presenting, Lisa, and how do you do it? But I think I'd like for Lisa to answer this, but I'd like us also just to think about this in terms of what are the ancillary aspects of social protection which involve community involvement? Because I think that's kind of what people are asking about. So first over to Lisa, and then if Dom or Carolina want to add.
Yeah, thank you. That's a really interesting question. So I think one observation that I have is mentoring can occur in different ways and in different contexts. So that's important to think about. And it's also important to think about that needs to take place in a relationship of trust, which can take some time to build. So building on that, just to get a little bit specific, I think, in our projects, there were either trained social workers or parasocial workers who were engaging with the families on a regular basis. So ideally, they were meeting with them once a month, sometimes more frequently, sometimes less frequently, excuse me, depending on family need. And I think that kind of recurring interaction and discussions at the family level about how can you budget, use your family resources in a child-friendly way, and what do you need to support your children, and helping people think through those processes were very important. I think savings groups for our participants who were members of savings groups were really important because members could exchange information and help each other think through problems. And then, sorry, I'm about to die. I think there, excuse me, an area of concern was whether or not you trust those people. So there are some forms of local savings institutions, or even more formalized ones, where someone absconds with the resources. And so when you think about those community mechanisms and how mentoring might take place at the community level, whether that's through your church leaders or savings clubs or village chiefs, I think people have to really feel confident that the people who are mentoring them and supporting them are trustworthy and are not going to do harm to them when they're giving financial advice. So let me turn over to someone else while I grab a glass of water.
Of course.
Yeah, I can come in if you like, Alex, just to share like maybe another side of community involvement. This is something that we have been working a lot over the past months. In vulnerable settlements here in Argentina, and I think this is something that maybe the colleagues from the region can also share, there are a lot of work that is done at community level by community leaders. There are neighbors from these very same settlements that do a lot of community work in terms of supporting families to access social protection, for example, to help them with all the bureaucracy and to share with them what options do they have. A lot of them run community services like maybe early childhood care centers or soup kitchens. Or there is a lot of work done at community level that is done by the very people that live on those areas. And that is done without an acknowledgement by the state, and that is done without payment. It's like volunteer work that they do to improve their households and their neighborhoods. And that is key. I mean, there are places where this is the only hand that is reached, and the only people that actually can access families. And this has also to do what Lisa was mentioning regarding trust. These are the people that know these families, that live with them, that share the same experiences. And sometimes it's the only person that is actually doing like this link between the public policy and the people. And here, at least here now, there's a big discussion around this because a lot of these women, because there are 90% of them, they are women, have gathered together and they are part of organizations and they are demanding for this acknowledged. So they are even going to submit a law bill on the 8th of March, which is the Women's Working Day, to receive an acknowledgement. They are asking for a salary. They say, this is a job we do that actually goes that last mile between the public policy and the families. And so I think that that's another thing that we maybe have to think about, because a lot of the social policies in our countries, at least, is sustained on the work of these women. And this is something that is not always visible in public policy. Thank you.
Thanks. I think Don was going to come in briefly as well.
Yeah, thanks. The role of the community is absolutely critical for various reasons, but it's always good to remember that when you turn up for a human service in whatever welfare system, you don't knock on the president's door, you knock on someone local to you, and a lot of the delivery of these key services are close to home. I mean, they're grassroots, and so the knowledge and understanding of the needs of the community, etc., someone kind of built in. And there's some interesting pros and cons with the way governance is set up, which are worth looking at if you're interested in some of the work on integrating human services. But on the family policy and the SDGs, whether we're looking at nurse-family partnerships or guidance through family intervention in health services, the role of mentors and guiders at the point of service delivery, it can be progressive universalism or targeted services, have been shown to be many times more effective than cash interventions alone, or unique center-based interventions where you just take one member of the family and you only talk about a specific issue. It's saying, well, you exist in a context, and if I can understand and mentor you in that context and guide you through it, then you're likely to take up my evidence, take up my advice, and act on these things is much higher. And to some degree, the cash plus with the information stuff also shows the same. Remember, to make a good decision in life, it's not just whether you have the money, it's whether you know what to do with that money. And so without mentoring, in some cases, you're stuck.
Great, thank you. Thanks for those responses. I'm trying to decide which few of the many great questions we can cover. There's one on that maybe just a quick answer to. This might be mostly with Dom. Are there countries that are implementing truly integrated social protection and care systems, or particularly social protection systems? It would be interesting to understand how beneficiary duplication is avoided.
Yeah, I can take a couple of quick examples. Nice example of sort of home care visiting in Brazil. Crianças Felizes and the efforts there to sort of passport, for, let's say, for want of a better word, from one service to the next, that identification of need is a form of progressive universalism at the service level. In the cash level, I'm going to talk about Argentina now and compare it to Switzerland, Japan, Belgium, and the mighty country of Liechtenstein. Apologies if you're there, it's only a small place. But what they have is they have matched social insurance and social assistance family cash benefits, unlike Argentina, which is why you get that gap in the middle in Argentina. These are aligned. So you drop out of one, you fall into the other. You know, if you can move from social assistance to social insurance as you go into work, and the system speaks to each other. So there are examples out there, and that might be something useful for countries like Colombia, countries like Argentina that have the two sort of the sort of split systems. There's not a great deal of examples of split systems that function together outside of high-income countries, and unfortunately. And it's because there's a lack of overall social protection. But Yeah, I suppose that's the best I could do. I wanted to say something else, but I've forgotten, so I'll type it in if I remember.
No worries. And maybe I'll ask as we're closing and in my final remarks, if our panelists would like to type in responses to any questions in the Q&A, if you can, that would be great. I want to focus on this one last really crucial question, which gets at the heart of why we're all here today. A questioner has written in, I'm interested in how organizations working towards supporting children and families from a perspective of preventing separation can collaborate with organizations who may be coming from a social protection and household economic strengthening position. How can we connect and collaborate more effectively and create synergy in our missions?
Well, child protection systems are there to protect children. So I think, when we think about when we think about our ecological model and how we support children at multiple levels and the kind of, I think that we need to think about that, both at the national level and at the very local level as well. And, in the best of all possible worlds, an organization that was focused specifically on addressing prevention or on reintegrating children would be working within the broader ecosystem of child protection and the child protection system. And so I think that, that part of the answer to the question is coordination and communication at the local level, having platforms and mechanisms by which referrals can, cross referrals can be made, where local actors understand, kind of what the whole constellation of support is for families and how they can help families navigate that through different types of services. And that there is a common understanding at those levels of what the main challenges are that families are facing, who the most vulnerable families in the community are likely to be and what their profiles are. And that that organizations of different types are working more synergistically and in concert with government, are supporting government to perform its functions, so that they don't see themselves as working just, in an individual organizational or projectized basis, but they see their work as part of a larger system. I'll stop there and let somebody else jump in.
Great, thank you, Lisa. Dominic, Carolina, would either of you come in? Both unmuted. Carolina.
Maybe just quickly to come with what Lisa mentioned. I think that coordination and articulation are key. I think that the child protection system may have the possibility to raise also some alerts. They are in contact with families, and when they identify a family that maybe comes to the social protection system for one thing, but when you work with that family, you realize they also have other rights that have been affected, and that coordination can help navigate that system. But also I think that of course prevention is the key, but there is also a lot to do in terms of articulation once the child has gone into the social protection system and has maybe been separated from their families, and how do we help to revert that situation or to help that child when he exits the social protection system. One experience we had in Argentina was regarding adolescents when they turn 18 and they have to leave for example, the residential care system, and somehow they are left alone, like, okay, you're 18, goodbye, and deal with your life and get a job and a house and everything. So there was a coordination there between the child protection and the social protection system to ensure that those adolescents have access to a cash transfer that allows them to leave the residential care facility, and also work with this mentoring and help from someone, mostly a social worker, but somebody that has been in touch with the child during the part that he lived in the residential care, and help him or her to manage this money, how to pay a bill, how to buy food, a lot of things that adolescent all of a sudden will have to do by itself. and how to help them navigate and gain that autonomy. So I think that that's another thing that needs to be taken into consideration, maybe.
Great, thank you, Catalina. What a nice concrete example at country level of how you do this and make it happen and make it work. I'm hoping Dominic will now come in with the big picture approach to this issue as we close out the discussion today. Dom.
Oh, well, I'll quickly say that I think in terms of child protection services and supporting of children, we need to use the evidence to show exactly how important child protection services are for child well-being, development, and overall. I did a study, a meta-analysis, 26 longitudinal studies looking at what drove variation in education. And remember, that's the biggest ticket across child expenditures wherever you are in the world. And more than previous levels of education, more than poverty, more than health, and more than family functioning, failures in child protection drove a child's educational returns more than anything else. And if we can't get that right, we're driving inequality, we're failing children's rights desperately. And if we still need to make an argument with the people who hold the purse strings, the arguments are there. The cost effectiveness of simply ensuring that all children are safe is above and beyond anything else we can do. So that's my final word.
No, thank you, Dominic. That also brings us back to, it's not just the child protection, that the child protection sector needs to collaborate with the social protection and social welfare sector, but vice versa. If child protection doesn't work, then social protection goals aren't met as well. And I think that was really nicely put. But with that, we have come to the end of our webinar today, practically on time, almost exactly on time. So I want to thank everyone for participating today. And of course, our very, very special thanks to our panelists, Catalina Alesino, Lisa Lellman, and Dominic Richardson. Also, big thanks to my colleagues at Better Care Network and UNICEF who've been working behind the scenes today, Catherine Ronberg, Margot Cornelius, Florence Martin, and Annie Kulkarni. I'd like to let you know that the webinar recording, presentation, and resources will be shared with all participants, and they will also be posted on the Transforming Children's Care platform. Please do consider joining the platform if you haven't yet, as well as the task force on family strengthening within that platform, if you'd like to continue the discussion around social protection and other family policies and help contribute to the brief. Thank you again to everyone for joining today.